Hey, this is Paul, and it's been 2 weeks since my partial knee replacement surgery, so I thought I'd give you guys an update. So yesterday I saw the doctor, and I had pretty good results, so they were real happy with where I was. I got it done at Rebound Sports Medicine, and I had Dr. Todd Boris do it, great doctor, and had x-rays, got a chance to look at my inside of my knee. Nice little piece of metal in there with some plastic. Overall, they took the stitches out on the top and the bottom here, and this middle section are dissolving stitches, and they just told us to leave the bandage, these little bandages on, they'll eventually fall off, but the waterproof bandages have been removed, so that's great. So overall, let me see, probably around day 10 or 11, I stopped using my crutch, and to me, I was really conservative with that, and I started every now and then to forget where I put my crutch, which is probably a good sign. So I'd go, oh, where's my crutch at? So, it was a slow process. Eventually just use it less and less. So use pain as your guide. I think that's a pretty big deal. Otherwise, continuing to do PT every day. And it's been a little bit interesting. It's kind of a roller coaster. The PT's been going good, but maybe after PT and, later in that afternoon, just get super tired every now and then. Some days are better than worse. So I think between week 1 and week 2, I had some days that were awesome and some days that were just okay. As long as you continue to trend upward, I think that's great. But you're going to have these days that some days are worse than others, some days are better than others. Just your body going through the process of healing. So as far as myself, I've been really working hard on obviously flexibility, so I've been pretty good about flexing my knee. Got pretty good results here, and then all the way up to there, which is great. And of course, Alfred is happy with that. And then, knee bend wise, I'm getting a really good extension, really good movement here. And so, again, these are things that I've been working on slowly, and probably a week ago, I couldn't do those knee bends. And, just start slow, use pain as your guide, as those guys told me. And again, you're not supposed to overdo it too much. You're supposed to work hard in the gym, but not to the point that you feel you're going to be getting a lot of overdoing it, because you don't want that inflammation to come back and you don't really be chasing it. So that's it for week 2. Very, very happy with where I am today, and we'll give you guys an update probably in a couple weeks. Really excited about it, and hope to be back, maybe doing some outdoor activities in the next couple weeks, just maybe some light hiking and whatever. But again, I'm going to go slow and just be careful, follow the doctor's orders, and continue my therapy. Thanks a lot for watching.